So we need to get more and more folks who identify as Hispanic vaccinated. We've only gotten about 1,600. We have a long way to go.
Dr. Thomas Dobbs and a number of Hispanic healthcare workers are hosting a town hall in partnership with Jackson State to discuss myths around the vaccine. The Department of Health says Hispanics make up 1% of the state's total vaccinations, but are roughly 3% of the state's population.
What can we say about benefits and risk of COVID-19 vaccines? Well, in terms of benefits, the vaccines reduce the risk of infection. They reduce the risk of complications from infection.
Dr. Adolfo Correa hopes by educating Hispanic Mississippians about the benefits of the vaccine, more of the community will want to receive it. The Department of Health says communities of color are hesitant, largely due to mistrust. The same goes for African Americans.
We know that there's a couple of things that could be happening, certainly hesitancy, but also are we putting the vaccine in a place where African Americans can easily get to it.
Early data shows African Americans make up 16% of total vaccinations, yet represent 37% of the state's population. Another theory from health officials is African Americans want to receive the vaccine from their own physicians. Private providers receive a very small allocation of the vaccine compared to the drive-through clinics.
You mentioned the 6,000 or so doses that we sent out to external partners. We're trying to do that in a mindful way to make sure that we do maximize our abilities to have it available for African Americans.
The Department of Health says they're looking at the data and are working to solve the disparity in vaccinations among minorities.
Right now, we have approximately 22,565 individuals who have received their first dose that are listed as other. They're not listed as white or African American in the data, and so we're trying to improve data collection so that we have a better, more accurate viewpoint.
Cecil Hannibal live for us tonight. And Cecil, you spoke to health officials today about the vaccination program. Tell us about what they're saying about their goals for the month of February.
Yeah, Governor Reeves has set a new goal for the state of Mississippi. He wants to reach a capacity of 100,000 doses each week. That includes first and second. Now, we know the state has said the federal government is going to increase their allocation from 37,000 first doses each week to 43,000. Now, that could help the state's vaccination program and ramp up vaccinations each week. In Jackson, Cecil Hannibal, 16 WAPT News.